Don't have sex, because you will get pregnant and die. Don't have sex in the missionary position. Don't have sex standing up. Just don't do it, promise? Okay, everybody take some rubbers.
Hi, I'm Tarryn. I'm doing a health class PSA on STIs and STDs. As teenagers grow up, particularly older teenagers who are juniors and seniors, sometimes even younger, want to feel like adults and make their partners happy. But here's something you know. 32% of high schoolers have had sex in the year 2025. In 2023, 6% of U.S. high school students have reported being tested for STDs in the past year. A significant proportion of sexually active high school students at 20.4% reported testing for an STI, with female students at 26.1% more likely to test than a male student at 13.7%, according to a study published by the PMC. Gonorrhea and chlamydia are the most common STIs in teenagers, with half of all new STIs occurring in those aged between 15 and 24 years old. Many STIs go undiagnosed and untreated, highlighting the importance of testing and open conversations about sexual health. With gonorrhea, you might experience painful urination. You may feel a burn, discharge, surfexitone, often from the penis or the vagina, vaginal pain during sex, intermuscular bleeding between periods. With chlamydia, you might experience painful urination. You may feel a burn, pain in the dioxylacine oral or lower abdomen, lower back pain, fever, vaginal erythromotion, oral or discharge from the penis, vaginal pain during sex, or bleeding between periods. With syphilis, you might experience a primary painless sore at the infected area, purulent, usually by site, secondary rash, fever, swollen lymph nodes, infection, sore throat, hair loss. Is it latent? No. Symptoms are hereditary, severe complications affecting the heart, brain, nerves, eyes, and other organs. With trichomoniasis, you might experience itching, burning, redness, or soreness of the genitals, discomfort with urination, change in vaginal discharge, with thin, clear, white, yellowish, or greenish, with an unusual fishy smell, or pain during sex. With herpes, these are not curable. Herpes with antiviral medications like Ascletir, Velichivir, or Pharmacovir can help manage outbreaks and reduce the frequency of reoccurrences. With HIV, you might experience antiretroviral therapy, also known as ART, used to suppress the virus and prevent the progression of HIV to AIDS. Also, many teenagers tend to see sex in the movies and want to be just like them. Many movies in Hollywood describe it as pleasure, fun, and no worries, which can't be further from the truth. What they don't talk about is STDs, pregnancy, complications of pregnancy, along with anxiety, depression that comes along with the aftermath of people most likely or potentially finding out, and spreading rumors on social media without the person's knowledge. Yes, that happens. Also, when students get pregnant, she could experience horrible name-calling, teasing, and all the stuff that I obviously can't say on here. But unfortunately, the guy will get what's called the cool points, and society doesn't look down on them for it. And the reason why is because with the girl, it's obvious that she has had sex, but with the guy, there's no evidence. And kids tend to use social media for obviously incorrect reasons, and they tend to make fun of the girls usually on there. Also, if you're a virgin, that means you have never had vaginal sex or oral sex. If somebody says they're a half virgin, what they most likely mean is they have had oral sex, which is why they should most definitely get tested for an STI or an STD. I hope this helps. This is Tarryn Kwast signing off. Bye!